I first learned about SoftWave through primarily LinkedIn and other kind of physician oriented or professional oriented social media. And so I heard a lot about it. And people were speaking about it very positively. And then I started hearing about it from patients that they were getting this done for various conditions and having good results with it. And finally, I had an opportunity to see it at a conference in person, which really helped me better understand what exactly the technology was and why it differed from other shockwave therapies. We initially started with a different shockwave device, and although it did have a positive impact on our practice and it did yield good results for some of our patients, there were definitely some problems with it. So, the first problem with the other shockwave device that we had in our office for a while was that it was very loud. It was louder than our current SoftWave device. So loud that some people could not even tolerate how loud it was. The other thing that we found was that it was much less specific. We were not able to really find the spot like I was expecting we would be able to find the spot with that device. It took a lot of physical pressure on the applicator, so the person operating the device had to really put a lot of muscle into it, which made the staff not want to participate in it. In addition to it, I think because there is so much sound energy that escapes with those other shockwave devices, it is very difficult for the operator. I think that it's not only loud, it made certain people in our office feel funny, and I can't really describe how, including me. It felt like I drank too many cups of coffee after I did too many sessions of it, when I performed too many sessions of it. It was very interesting. And so when I had an opportunity to look at the SoftWave device during a conference, I immediately noticed that there was less sound energy escaping from the applicator. I could immediately tell because of the unique applicator design and the water the electrohydraulic function of the applicator, that really a lot of the sound energy was being concentrated in the tissue and was not escaping into our ears and into the environment, and was really all being applied directly to the patient's problem area. There have been certain indications where the SoftWave has just been so immensely helpful, where SoftWave is superior to practically any other treatment modality, whether it's an injection or surgery or medicines, is when a patient has a acutely or kind of newly formed effusion, meaning that they have fluid inside of a joint or inside of musculoskeletal tissue, such as a bursa, or inside of a joint, and it's relatively fresh and new. Now, there has been nothing in my experience, whether it's massage from a chiropractor or a massage therapist, or other physical modalities from a physical therapist or a chiropractor, or any of the other devices on the market, or an injection or surgery or medicine that really mobilizes the fluid like SoftWave does. For example, if someone acutely injures their knee and their knee kind of swells up, most of the time they just have to kind of live with it and let it settle on its own. And that festering inflammation, I believe, will contribute to a much larger problem in the future. Now, with this intervention, someone can come in the day after an injury, and as long as a medical staff member has determined that it's safe to use it, you can apply the SoftWave directly over that area. You see an immediate result where there is less fluid in that area, and the patient can immediately feel it. It's really incredible. Even just acute injuries in general that are not a fracture or not something, getting snapped in half. So typically these injuries do require some sort of evaluation. However, most acute musculoskeletal injuries do really well with SoftWave. And I would say that SoftWave is better than practically any other treatment that is available that I've ever seen for an acute musculoskeletal injury. And so even for chronic injury, it can be incredibly helpful because it increases blood flow to the tissue. It helps mobilize the fluid and remove some of the fluid. It helps stimulate stem cell production and MSC activation in the tissue. And so it certainly helps with chronic issues as well, but chronic issues typically require a multi-pronged approach in which I almost always use SoftWave as a part of the treatment modality. But where I think SoftWave is an absolute star is for acute musculoskeletal injuries. The way I use SoftWave for orthobiologics is typically I have a consultation, an in-person consultation with my patient. Some patients are from out of town, so we may have to delay the in-person component of the evaluation. But as soon as I get the patient in person, before I even plan or formalize the final plan for the orthobiologic treatment, I use the SoftWave device as an extension of my physical examination because physical examination is notoriously difficult to discern certain pathologies. There are many pathologies that mimic one another, and a physical examination can be helpful, but sometimes fails us as well. And so I pair a physical examination with using the SoftWave to identify the most painful areas for a patient. So, for example, when I am seeing a patient with sacroiliac pain or low back or buttock pain, which is very, very common. It is rarely just SI joint pain. Many times the joint above that area, which is the L5S1 facet joint, the next joint down, which is the hip joint, or even all of the structures that connect the SI joint and the hip can also be problematic. Now, with conventional physical examination maneuvers, sometimes a patient feels pain and discomfort in a lot of different planes. And the SI joint is notoriously difficult to garner any very useful information out of a physical examination. In fact, many third-party payers, such as insurance companies, require 3 or 4 physical examination maneuvers to be positive to indicate that it is actually sacroiliac joint pain. And so realistically, there are a lot of mimickers of the SI joint. However, when you put that applicator directly over the SI joint and turn the SoftWave on, it is clear as day to the patient and to the provider that's where the source of pain is. And now you may take that applicator and you may go up to the L5S1 facet joint and they may have some pain there, and you may take it over the gluteus medius muscle and the gluteus medius tendon and the piriformis muscle and the gemelluli and other structures that are close by, and they all may be sore. But when you are trying to explain to a patient what the root cause of their pain is, this device absolutely helps them understand and you understand that the most painful area is typically either the root cause or one of the key components of the pain condition, and it helps everyone understand what our targets are. So I use this device to determine all of the areas, all of the pain generators. And so, for example, with a person with sacroiliac joint pain, if they have the most pain around their SI joint, but they have some pain in the low back, some pain in the buttock muscles and on the outside part of the hip, I construct an orthobiologic treatment that is going to be all inclusive of all of that anatomy. And I say, well, the most concentrated orthobiologic is going to go into the sacroiliac joint because that seems to be, based on your history, your physical examination, and the SoftWave, that seems to be the key pain producer, the key element of pain here. So the most concentrated orthobiologic will go there. But we also need to co-treat all of these other areas which are sore and contributing to the pain. And so many times patients are very skeptical of getting multiple injections done at the same time, or treating a functional segmental unit, or treating the entire kinetic chain. Many patients are skeptical of this because they may have gone to their orthopedic doctor, down the street from them, who said, well, we're just going to do a steroid injection into your sacroiliac joint, or we're just going to give you one steroid injection, and we want to keep it super concentrated. If we spread it out, then it's not going to be enough for any of these spots. Well, that is a very different approach to treating a patient using steroids and other catabolic treatments, such as ablations and many of the other procedures that physicians like me routinely perform for patients with painful conditions. With orthobiologics, it's a very different mindset. We have the opportunity to co-treat all of the anatomy together, but we want to put the strongest stuff in the area that is the most problematic. And this helps you get buy-in with the patient, because they understand that, yes, I am not only sore in the spot that hurts all the time, I'm sore kind of all over the place. And if this doctor has an opportunity to lift all of that anatomy up together and address all of that tissue at the same time, then I'm going to let them take that opportunity. So I immediately get buy-in, because just showing patients MRIs and just doing physical examination maneuvers and just speaking with them many times is not enough, because it is difficult for them to understand why their other doctor never mentioned this approach before. But when you are stepping into the world of orthobiologic, and you're stepping into the world of anabolic treatments that help create tissue versus destroy it, such as SoftWave and PRP and stem cells and other things, other treatment modalities in the regenerative medicine space, you have to change the patient's mindset. And I think that is one of the key things that SoftWave helps you do, is you get buy-in with the patient and you help change their mindset, so they understand that we're trying to make this a lot better forever. We're not trying to make it just a little better for a short period of time. Using SoftWave as a complementary tool to what we do in our clinic has really facilitated and accelerated patients' healing. In addition to facilitating and accelerating the healing process, SoftWave also helps a patient understand that they are getting better. So I typically do one session of SoftWave the day before the treatment to help plan my treatment. And then I typically bring the patient back in 2 to 3 weeks after the initial treatment. And then I will treat them with SoftWave again every 1 to 2 weeks for the next 4 to 6 weeks after the treatment. I do this because with orthobiologics, stem cells, PRP, prolotherapy, any of these things, when we use orthobiologics, it takes time to improve. When you can show a patient, last time you were on energy level 10, this time you're on energy level 12, even if it hurts the same while we're doing it, they can see the settings, they can see what's happening, they can feel what's happening, and they notice, yes, I'm able to tolerate more, and my body has not changed, my brain has not changed. Something may be happening, even if they don't feel the pain relief that they're expecting by the 6-week mark, which is very common in orthobiologics. It may take 3 months, it may take even longer to achieve the full potential of the treatment. But when you have SoftWave as a device to help assist and accelerate the healing, patients also get that feedback for themselves, and they see themselves being able to tolerate more and more on the device, and they understand that something is happening, maybe not as quickly as they want, but something is happening. With the SoftWave device, we've been able to retain more patients, and been able to refer patients for only very serious conditions, and keep all of the patients who have a chronic disease that is not serious but bothering them in our office, because many times it does provide at least some improvement and buys us a little bit of time to come up with a really comprehensive plan. And so we see less patients just leaving the practice and finding other care. And we also see that we have to send less referrals for patients who do not have an urgent or emergent need. any acute musculoskeletal injury. So meaning that if you were jumping on the trampoline and your foot turned, rolled in the wrong way, or, you were doing too many push-ups and, your wrist is really hurting afterwards. If we get to that patient on time, then we see a lot of one and dones or one and two and dones, meaning that it's just in their rearview mirror. And, many times an acute tendon injury in the foot and ankle can mean 2 weeks in a boot. We are able to see 1 or 2 days in a boot and almost immediate improvement with some of those acute musculoskeletal injuries. So I see a future with SoftWave where it might be in every urgent care, it might be in every pediatric office, it might be in every family medicine office, where if somebody has an injury, and as long as it's deemed not to be dangerous, like an acute open fracture or something like that, they get this treatment and their recovery goes from days and days or weeks or even longer to like hours to days. So that's where I see SoftWave as the biggest winner, is that anytime anybody I know has a injury that just happened to them, and as long as it is not a dangerous injury that needs to be further evaluated, if it's an acute kind of musculoskeletal strain that is really bothering them and really preventing them from doing what they need to do. I mean, I have saved people from having to cancel trips. I've saved people from having to cancel operating room days because we were able to get them in on time and make their pain basically disappear in a single session, with no medicine, with no needles, with nothing piercing the skin. And it really, I mean, and I have a lot of doctor friends that I've used this on, a lot of doctor friends who get some sort of injury and really need to be at work on Monday. And over the weekend, we're able to practically reverse that injury, which is just mind-boggling to them, mind-boggling to me, and to really everyone who's involved. I used to be surprised by some of the benefits of SoftWave, but now I'm less surprised. I expect it to surprise me because people note that the tissue is just more resilient. Patients of mine indicate that they feel that tissue is stronger than it's ever been. So there are some unique insights that we get kind of all of the time, and we've treated some very unique situations. For example, we had a patient who had a great success with her foot and ankle and her shoulder with the SoftWave device, and she has autoimmune hepatitis. She presented me with some case reports where extracorporeal shockwave therapy was used for autoimmune hepatitis, and she convinced me to use the applicator over her liver for several sessions, and she did use kind of a multi-pronged approach. She changed her diet, she changed her lifestyle, but she was very insistent that we try this because realistically, the option for those patients is waiting until you need a liver transplant. She is a single mother, she has a job, she has a busy life, and she really did not have time for a liver transplant. And I cannot say it was only the SoftWave because she changed a lot about her life, but she credits the SoftWave with improving her lab numbers and improving her overall liver function as a multi-pronged approach. So there are even unique indications that SoftWave has. So at this point, it does not surprise me anymore what SoftWave has the potential to do. SoftWave has impacted our bottom line in the following ways. So one, of course, it's an independent income generator. And I, as the medical director, do not have to be physically present for every single treatment, which is very helpful because most of the revenue that we generate in this office requires me to be physically present or for me to generate the revenue. So it's nice that there is a little bit of passive income that is being generated. I would say the second and most important way that it has changed our bottom line is that it has really helped patients understand the importance of a complete treatment. Because many times patients may, especially in the United States, with this kind of concept of consumerism, where some patients may feel, well, let me just purchase the bare minimum option, the cheapest option. If it's my hip and my ankle and my knee that's hurting, I just want to treat my knee. And although that can make sense in certain patient groups, when we use that SoftWave and connect all of the dots and show them how their hip pain through the IT band is connected to their medial knee pain, which through the posterior tibialis is connected to their ankle pain, patients immediately realize the importance of co-treating all of these areas. And they understand after we explain, all of these things, all of these problems are beholden to one another. And just treating one problem may not be a successful strategy. SoftWave has helped my patients understand the importance of co-treating all of the tissue at the same time. And yes, it does add expense because we typically, when we treat more areas, it does cost more. But we have a much higher likelihood of getting a outstanding result when we co-treat all of the areas. Of course, there is more revenue that's generated for the clinic because realistically, if you look at just a knee treatment, it is about 1/2 to 1/3 of a treatment that includes the hip, the knee, the ankle, and everything in between. And so we're able to generate realistically 2 to 3 times more revenue on select patients, which that in and of itself made the device pay for itself in the first year. So not even including any of the income that was generated from the device alone, but just helping patients understand the importance of treating the entire kinetic chain, which I think is a very hard concept to understand with just words, just conversation. It is just difficult. And it's even more difficult because many of our physician colleagues don't think that way. But most folks in the regenerative medicine community understand the importance of co-treating the entire kinetic chain. And helping a patient understand that is going to not only give you a better connection with the patient, but once again, it does help generate more revenue because you can kind of treat more in one session. That alone has paid for the SoftWave device. I would say, I don't know, I don't have exact numbers on that, but it definitely in the first 12 months, probably by the 8 or 9 month mark, it was clear that our revenue was up and our per procedure sales were also up. I've done this job for about 9 years now, and I've had the SoftWave for about 3 years. And I have not been able to explain to the patient in a way that they would understand the importance of kind of co-treating all of these areas. And SoftWave does that in a matter of minutes because actions just speak louder than words, especially when it's kind of an elusive subject like muscles and nerves and things like that. The SoftWave definitely helps foster a much healthier relationship with the patient because typically how I do it is I have my initial consultation in person, do the physical examination, review the imaging with the patient. I give them an idea of what I believe the differential diagnosis is, but I say, this is just me thinking out loud. A part of our initial consultation, free to the patient, is one session of SoftWave with me. I run the applicator over the areas that I think are most problematic, and I invite any family members who want to come in and see whatever the patient wants to come in and join us in the SoftWave room, and everybody's immediately on the same page. And also a lot of patients are just very happy that they're getting an additional service that is completely free, and many times SoftWave provides kind of this immediate benefit that may not last forever, depending on how chronic the condition is. But when you can make a patient feel better in terms of their pain and in terms of their overall trust in your institution in the first visit, it really helps foster a very healthy long-term relationship with the patient.